Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 37 new cases of COVID-19 in Windsor and Essex County. Of the 37 cases, 17 are close contacts of confirmed cases, 5 are community acquired, 2 are outbreak related, and 13 are still being investigated. We have had 13,928 cases since the beginning of the pandemic. 13,188 cases are now resolved, and 337 people are active at this time. There are now 79 preliminary or confirmed variants of concern identified in Windsor-Essex County. 4 cases have the UK variant. 14 cases are currently in the hospital, and 4 people are in ICU. Our community has lost 403 people to COVID. There are currently 7 active outbreaks in Windsor and Essex County, 4 workplace outbreaks, 2 community outbreaks, and 1 school outbreak. Now for our vaccine update. A total of 93,640 doses have been administered to Windsor-Essex County residents. 81,335 have at least 1 dose of the vaccine. Last Friday, we announced that residents 70 years of age and older are now eligible to receive a vaccine through one of our targeted vaccination clinics. New appointments are being added daily, and there are still spots available for this weekend, so please check in regularly at wevax.ca or wechu.org to book your appointment. Alternatively, please call 226-773-2200 if you need assistance, and someone will be able to help you book your appointment. Our vaccination clinics are still running over the weekend, the Easter weekend. Please check www.wevax.ca for clinic locations and to book your appointment. WFCU is fully booked today and tomorrow and will be closed on Sunday and Monday, and appointments will be available again beginning Tuesday. Amherstburg Libero Center is fully booked today and tomorrow, closed Sunday and Monday, and it will be open again on Tuesday. Leamington Nature Fresh is closed this weekend and will be open Wednesday and Thursday of next week. Sportsplex will be open Friday, Saturday, Sunday, and Monday, and there is availability this weekend. Windsor Hall downtown, they are open Friday, Saturday, Sunday, and Monday with availability this weekend as well. Regarding the pharmacy pilot, there are very few pharmacies with remaining doses for residents 60 years and older, but we've been told that all of these doses have been booked. You may be lucky and get a cancellation, so if you would like to call a pharmacy directly to determine if there's any vaccine, please visit wevax.ca and you will have locations and pharmacies identified there. Please note that at this time, all bookings at vaccination clinics are for first doses only. For general inquiries regarding vaccination, please call 211. Regarding our health unit offices will be closed to the public over the next 4 days for the Easter holidays. Doesn't mean we don't have staff working, but it is closed to the public. Our next YouTube broadcast will be on Tuesday, April 6th. The website and emailed update for local COVID numbers will occur on Saturday, April 2nd, and there will not be updates on Friday, Sunday, or Monday. Hope you all have a safe and happy holiday weekend, and I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us on the first day of April. Tomorrow, Good Friday, marks the first day of the Easter long weekend. For many residents, this is the time of the year, a time for their family, for connecting, and for traditions. This year, we may still be able to honor some traditions while building new ones. This weekend is a great time to slow down, focus on family, yourself, and your well-being. Some tips for the weekend include go outside, enjoy the fresh air, go for a walk, bike ride, or garden. Getting active is an important part of positive mental health. Plan a virtual meal, brunch, or dinner. Connecting virtually allows us to celebrate Easter with those we love, including friends and our families that might be far and normally not able to join in for a family gathering. For kids, paint and decorate eggs and plan an Easter egg hunt in your house or your yard. Drop off a home-cooked meal or Easter basket at the doorstep of your friends and family. Keep gatherings outdoors and maintain 2 meters distance at all times from those outside of your home. It is important that no matter how you spend your time, you need to wear a mask or a face covering when you are unable to maintain physical distancing from others. Wash your hands frequently with soap and water or sanitize with alcohol-based hand sanitizer. Keep the number of close contacts you have to a minimum. If you have symptoms of COVID-19, self-isolate immediately and go for testing. Remember, this weekend to practice self-care and follow public health guidelines to keep yourself and your community healthy. Thank you.
We'll now take questions from the media. Is there any questions from CBC?
Yes, good morning. This morning on Windsor Morning, we spoke with Dr. Saad from Windsor Regional Hospital about why it isn't as bad here just yet. And he really talked about that vaccine strategy, our area being prioritized. Do you think that us being prioritized and receiving the vaccine, specifically in our pharmacies, that's really helped us here and will help us moving forward?
Absolutely. Our vaccine rollout strategy has been really good, and we were able to vaccinate a significant proportion of our population. And as Teresa continues to report every day, we are moving ahead. We are vaccinating thousands and thousands of people every day, and this has been going on since the beginning of this year. This in combination with some of these measures that are currently in place and people following those measures is helping us to manage our case counts to a relatively stable position. It's increasing right now, but we haven't seen the same increase as other regions have seen. We want to focus on continuing on to vaccinate as quickly as possible to get the maximum level of protection for our community and avoid a significant impact of any potential third wave in our community.
And knowing that we expect some sort of lockdown measures coming sometime today, what do you expect the lockdown results to be locally, given that we're kind of starting in a much better position than other parts of the province?
Well, I think if that decision comes from the province, we will have an opportunity to still protect and preserve many of the things that we have here, especially our healthcare system, and we won't have to deal with large number of cases that we have seen in the November and December and January timeline. And we may have if things go well and if people continue to follow these public health measures, we will be in a much better position to come out of the lockdown quickly than others. So I think we need to recognize that there are potential risks if and when people are not following these public health measures. And as a community, I think we need to recognize what is at risk, what is at stake, and continue to follow the good work that we have been doing and ensuring that we have a good handle on our COVID cases in our community.
Okay, thank you.
Any questions from Blackburn?
Yeah, I'm not sure if you can answer these, but just looking at our hospitalizations right now, they're still relatively low. But what we're hearing from the rest of the province is that these new variants or this third wave is affecting a younger population. Can you tell anything about the population that are in the hospital right now, or any of them connected to the variants, and what kind of age group we're looking at?
Yeah, great question. I did ask this question for my EP to work on, and unfortunately we couldn't get to it in a timely manner to report back, especially when there's been this conversation about the lockdown. But we should be able to present that data maybe in the next time when we are connecting, and we are particularly interested in that trend. As we reported last week, we have seen the opposite trend. While the ICU utilization is increasing in the province, ours is stable, or at least going somewhat a little bit on a downward trend. So we are in a much better spot, and I truly hope that we continue to stay that way and we don't have to deal with it, but we can definitely share more detail on that probably next time.
Any questions from Windsor Star?
Yes, yes, Doctor. Good morning, Doctor. Good morning, Teresa. Has the health unit received any advance notice about what kind of tighter restrictions might be coming down the line later today?
No, we haven't received any details or not even like a conversation at this time. We did hear informally from others, like not directly from the ministry, that there has been some discussion going on. We don't know what it looks like, what kind of changes. We may hear later today, I don't know when, but so far we are not privy to some of those details that's been happening at the provincial level, but also recognizing that, as we identified that our region is not the hardest hit region for this third wave, thanks God. And maybe some of the other conversation may be happening with the more with the regions that are hit harder than us.
Should more advanced or more enhanced restrictions come to this region today, how difficult is it, if at all, for your team to keep up? Because you have people who have to enforce these regulations.
Yeah, and I think it's not just the enforcement piece, but I think even just whenever the restrictions are coming, it's hard on everyone. It's hard on the people, it's hard on our staff, it's hard on at an individual level, but also as an organizational level. We recognize that there's a lot of restriction that have come from the province throughout the year last year. It was a very, very difficult year. It has a lot of impact on mental well-being. It has a lot of impact on economic well-being. So these decisions have a huge impact on everyone, not only just on us. When it comes to enforcement, I think we have worked together with all our enforcement partners, including the bylaws, the police, and everyone. And we have a good relationship with them by working together and do some of that. We and Teresa can add more. I think we had a lot of enforcement blitz that we have done locally, as well as in collaboration with the Ministry of Labor and everyone. And those were a really good opportunity to make that connection and provide that support to the community. We definitely don't want to be the enforcer of everything. I think we understand that everyone wants to protect everyone and keep the businesses open and keep the patrons safe. So that has been the goal so far, and whatever comes, it comes. And I think we just need to make sure that these, as hard as these lockdowns are, but based on the research, it is proven to be successful in controlling the widespread transmission of COVID-19. So I think the more lives we can save, the more protection we can provide for the community, and pass that curve and get back to our normal as quickly as possible with the high vaccine rollout. I do feel that we will be in a much better position, and that's the goal. I don't know, Teresa, if you want to add on that part.
Well, I think it's just the education as well. So with any further restrictions, there are a lot of questions and what is allowed, what isn't allowed. And so regardless of restrictions that may be announced for our area, the vaccine rollout will continue. That won't be impacted. We will continue to hold our clinics and to get people vaccinated, and want people to continue to go to our site, book their appointments, and get the vaccine that's available.
Thank you.
Any questions from AM 800?
Dr. Ahmed, do you think a provincial lockdown is needed, or do you think regional lockdowns are needed? The reason I ask this, for example, last summer when our numbers were kind of higher than others, we were locked down while others were allowed to open. Do you think we need a lockdown here in Windsor-Essex?
Great question. I think when we are talking about any kind of lockdowns, because of our mobility and because of how the communities are connected with each other, it is important that a broader lockdown results in a much better a broader lockdown results in much better containment of the disease. So that's been the principle that led the province to implement wider lockdown measure across the province. And even if you recall, when the lockdown measures are implemented, it was also implemented for the Northern Ontario as well, where we have seen very few cases throughout the pandemic. But because of the mobility and the risks of if you lock down one area and leave the other, you start to see more trend for people leaving one area and going into another one to do various things. So there is no, I guess, right or wrong in that sense, but if everyone is dealt with at times differently, like in the same manner, then we reduce the possibility of people's mobility. To answer your question of, when the opposite happened, when the rest of the province gets to in a better spot, and then you have one region that is seeing higher cases, and then it just creates the same concern that, if you don't contain your cases, it can spread to other places as well. So it is a tough one, and from our perspective, I think we continue to stay focused on what our local issues are. And as I mentioned, I truly want to believe that we have a great opportunity here. And luckily for us, we are not included in that high growth of or high risk of transmission in this wave, which is great. And that provides us an opportunity to, move forward and continue to vaccinate and keep our community safe, keep everyone safe.
Do you have any concerns or worries that some people might not follow this lockdown? For the most part, I think individuals in Windsor-Essex have been doing the best they can. Obviously, there is some that aren't probably following them, but I would say majority are. Are you concerned that some people have had enough and they won't take part in another lockdown?
Well, as I said, any of these lockdowns, these are hard. These are hard on everyone, and on individuals, on families, on businesses, everyone. It's not easy. It's not easy for anyone. So I understand that, but I think a broader community, our community, have seen how bad it can get and how quickly we have lost lives, how quickly we have seen the case rise. So I think for the greater good, there may be more consideration for that, and people, despite whether they don't necessarily agree with it, they will follow it. That's my hope, and I think we have got a great situation right now with the vaccine rollout and everything. We don't want to get it worse. We don't want to make it worse. We just need to make sure that we stay on track, and more people are vaccinated, we will be in a much better position. So I request anyone, even if they're thinking about that, that I understand their pain, I understand their frustration, but we have to follow these measures to keep everyone safe. The health and well-being of our community, of our people, are the most important measure and the most important thing. And we have to recognize that, as hard as it is, we will get through it, and we will come out after stronger. With more and more people vaccinated, we'll be in a much better position.
And then one question for Teresa in regards to the vaccine rollout. On Monday in Amherstburg, when we did the tour, you talked about the 70 to 74 age group, how the booking process was slower than anticipated. Has it picked up, I guess, since Monday?
Well, we do know that we have sites that are fully booked, WFCU and Amherstburg. There's availability at Sportsplex and the downtown site. So I think that, we are giving access to the current age group, and, I hope that we can expand that age group to allow more access for others.
Has there been talk to open it up to others, for example, 60 and over or 65 and over, if the 70 to 74 don't want to go downtown or to the other locations?
Well, it's not about not wanting to go downtown. They absolutely should go wherever there's vaccine available for their age group. So the opening up of any age group would be based on the fact that people that want the vaccine have had the opportunity to receive it. And we, with our vaccine supply, we have the ability to expand the age group a little bit. So regarding any discussion, yes, we're talking all the time about what next, and decreasing the age grouping to a lower age group would be a logical next step based on availability. We'd still want to give anyone 70 years of age and over the ability to get their vaccine, and they should be booking right now. But with availability, we want to make sure that we use our vaccines as quickly as we can, and opening it up would be provide further access. But we do know through the pharmacy rollout that these age groups that we're getting, that 60 to and above, that a lot of these age groups have had access through the AstraZeneca rollout through the pharmacies, and that has helped us a great deal. So I think I talked about it before, but people 60 to 64 in Windsor and Essex County, already half of them have been immunized based on the pharmacy rollout. So, this is pretty impressive for our area. So you can imagine when I say opening it up, we're not opening it up to, all 100% of that population. Half of them have been immunized. So we'll continue to look at all of the data and our vaccine supply and make the best decisions for our community, but also we need conversations with the ministry as well.
Thank you.
Any questions from CTV?
Yes, good morning. You'd mentioned several recommendations for Easter. What do you think is the most important piece you want people to follow and remember this weekend?
Yeah, the most important one, as we have always said, is if you are sick, please, you do not meet anyone, you do not do anything, you isolate immediately, even including your family members, and you go and you get yourself tested. And as we recognize that, it is an important time of the year, and people will be looking for some activities. And some of the other messages that we talked about is, choose those activities outdoor. The weather will be better, and it would be a good opportunity, and you're reducing the risk. And as best as you can, you try and minimize your number of close contacts as possible. I think those are the one that we really want people to recognize. And hopefully we don't have to see any negative impact of this this weekend with the rise in cases in our community.
Are the variants in the region, they don't seem to be as bad as the other areas yet. Are you hopeful that this potential lockdown could help prevent this area from being as bad as the other areas?
Well, I think that's the thought behind many of these lockdown measures is to try and prevent the ongoing transmission. And it has shown the value every time when you have a lockdown. It helps to reduce the rate of transmission. So the overall hope is definitely there that if we end up in a lockdown state, it will help to reduce the ongoing transmission in the community and bring the case counts down up until the point where we have enough number of people vaccinated to really reduce the ongoing transmission in the community.
And assuming that the lockdown is announced later today, will you be taking a look at the rules and the restrictions, and then seeing if any further actions need to be taken? I know that you can't lesser the actions, but just kind of having a look over and seeing what could need to be applied for this area?
Yeah, no, absolutely. We do that all the time. Our team is obviously on the ground as well, and they have better eyes and ears to see where we need to strengthen some of these measures, where we need to provide more education and more support to all the businesses that are that would be impacted by any of these restrictions. So we'll take a look at it, and we'll have to have that discussion and ensure that we are doing it all to protect our community and keep our community safe.
There's been a lot of discussion about schools remaining open, whether they'll remain in person or go remote if there is a lockdown in place. What do you think should be in place for this region for schools?
Well, it's a fine balance of the risk that we see in the school, and so far we have seen some cases in the school, and that has resulted in many dismissals as well. But overall, knock on wood, I think we were able to do fine with the school at this time. And even when we go back to November and December timeline, when we made that decision, it was because of the widespread transmission in the community. And we know that if the cases in the community increase, it has an impact on the school, because And these children will contract COVID from their family members or others and then bring it to school and then spread it to others. So that's where some of these risks happen. But we haven't seen that locally yet, so I don't think that there's any concerns at this time to say that the schools should be closed as well as a result of these lockdown. But again, I haven't heard any details what this potential lockdown would look like. And we'll have to wait and see. But locally, I don't think that we need to be concerned about our schools at this time.
Okay, thank you.
Any further questions from CBC?
Yes, I'm just wondering if you know how many of the variant cases are currently active. I think you said there was 79 total.
I don't have the breakdown by active cases. I'll see if I can provide that information later.
Okay, and then is there any update on the funeral clusters, if there's any more cases that have come of this?
I'm not aware of it. We had our daily meeting and nothing was brought forward, and Teresa is shaking her head as well. So I think we don't have any additional update than what we shared before.
Okay, thank you.
Any further questions from Blackburn?
Just one, you mentioned that most pharmacies are completely booked for their current batch of vaccines. Any word on when they would be restocked?
So I know that the ministry is looking at expanding their pharmacy rollout, and Windsor was in Essex County, that we were very fortunate to receive quite a bit of vaccine. I don't anticipate that we will receive too much in this next shipment. We have been notified that there will be AstraZeneca coming to our area specifically for primary care providers, and not a lot, but a small amount. So I believe that will be probably where we'll see some more access to vaccine is through the primary care providers in this next shipment.
Great, thank you. Any further questions from Windsor Star?
Yes, considering how many people age 60 and up have received the vaccine through pharmacies, is the health unit considering jumping that age group, maybe moving into the 55 plus for its next expansion?
We have not talked about going below 60. That would have a lot of people coming to Windsor and Essex County to get vaccinated from other areas. But no, we would be looking at either 65 or 60, but knowing that we have a lot of, we have had a percentage of both of these groups vaccinated already. But I think moving below 60 would definitely be something the province would have to be have approval from the province. And we still, just to remind everyone, our vaccine supply is still about the same. There has not been this, influx of vaccine. We know that until mid-May, we're looking at the same amount. And concurrently, we're doing vaccinating other groups as well, continue to do healthcare workers and some congregate settings and making some internal decisions about who else that should be prioritized. So we are using the vaccine. It's not only being distributed based on age alone.
What other congregate settings are you heading into?
So we are looking at areas that have a large proportion of people over the age of 50 that are in a congregate setting in a certain apartment building or at risk of, or have had outbreaks, at risk of outbreaks. We have discussions about the agri-farm sector. So we continue to discuss where we're going. And as you know, there are some mobile clinics right now. Our team of nurses as well as EMS, we've done some limited vaccinations in some apartment buildings with seniors and in areas that are higher risk. And we'll continue to look at all of the groups that are eligible and determine how we're going to reach people, and what are the vaccine needs as well, how much of the vaccine supply is needed to, to move forward.
Okay, thank you.
Any further questions from AM 800?
Dr. Ahmed, just looking at the website, I noticed the outbreak at the downtown Mission has been lifted. Would you say, or is it safe to say that's probably been one of the toughest outbreaks you and the team have dealt with since the beginning of the pandemic?
Well, I think it has its own challenges in so many different ways. The population, the complexity of how these everyone works together to support the various complex needs of mental health, addiction, and everything else. It definitely was challenging, but I think we got it through, and I think it did show that how quickly things can get bad, and hopefully we can keep everyone safe from this point onwards.
Thank you.
Any further questions from CTV?
No, thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Thank you.